with an increasing number of Nigerians groaning under the worsening state of the economy and the individual ability to access even the most basic necessities for survival being continually restricted, there has been a remarkable uptick in cases of nervous breakdowns and related health concerns. Correspondingly, access to basic health care is also being denied a lot of people as a result of the harsh economic environment. Medical tourism remains an option, but only to a negligible percentage of the population. Dr. Dorothy Jeff-Nnamani is CEO of Novo Health Africa, a leading health maintenance organization. She joins us now. It's good to have you with us.
Thank you.
All right, so if you were going to do an assessment of the current healthcare in Nigeria, how proactive or lack of it currently?
Well, the healthcare in Nigeria is quite complex, and it's not easy for people to navigate through the system. And when you look at access to care, before you can say somebody has access to healthcare, it means that it allows the person to enter into the health ecosystem. The person is also able to get the healthcare that they need locally within their vicinity. It also has to be affordable, and it has to meet their healthcare needs. And in Nigeria, we have a lot of barriers to all these things that I've mentioned. When you're talking about access, we have financial barriers to access. In the first place, if I'm thinking of accessing care, I have to be sure that I can pay for that service. Now, if you look at health services, from the time when, medical school, we've always been told that healthcare defies every market principle. Wow. So it's the only market that you go to. You do not know what you're looking for. Yeah. You do not know how much you're going to pay, and you do not even know if you would like what you get. So you need protection to allow you to enter that system. And within insurance, you can enter it. However, insurance alone does not ensure access to healthcare. Because when you get into the system, the next thing is, am I able to find what I am looking for within my locality? And that's where primary healthcare comes in. It means that I need hospitals, at least within the standard WHO specifies is within 15 to 20 minutes walking distance or within 5-kilometer radius. You must have a healthcare that you can access locally. Because if that facility is there, it deals with the local burden of disease. And that's what you want. If I'm living, let's say, near the airport, I'm concerned with respiratory tract infections. If I'm not getting it, I still don't have access. Is it affordable? That's the question you ask, whether you have health insurance or whether you're paying out of pocket. Affordability starts with the providers, where you get that access to care, where you get the real treatment. So when you get there, when they look at, you talked about the economy, which is really, groveling right now. The hospitals are also in business. So have they been able to organize themselves to make paying for that healthcare affordable? If I'm offering you health insurance and I don't take into cognizance what the hospitals are actually, using to run their business. So I sell you health insurance. Say, for instance, I sell it to you for 2 naira, and you get there, and then the doctor is saying, no way, I'm not treating this thing for 2 naira, I'm treating it for 10 naira. It denies you access. So it gets more complicated. Yeah. And then do you find the resources that you need in the health system? If you go to some hospitals in Nigeria, you walk in, the doctors are nowhere to be found. They'll tell you, oh, wait, they're coming. Sometimes even the nurses, nobody's in the hospital. Go to a Nigerian hospital on weekends, you find out that no single person is there. So it has not provided for me. The essence is for us to be able to move from that point of entry to saying, oh yes, I'm satisfied with what I'm getting. So it's a very complex one, and I think that it leaves a lot, to be done. We still have a long way. Access to healthcare in Nigeria is really complex. You have to know how to navigate it. You have to know what you're looking for and where you can get it. And that's why you still see many people go and treat malaria in a tertiary institution. They're going to a tertiary institution to treat malaria. These are the things that you can get within your vicinity in a primary healthcare facility if there is one.
Okay. All right. You've been highlighting on the complexity of the healthcare system in Nigeria. Well, let's talk about the present problem facing them. People have accused the enemy of always being more in the limelight because of strike actions as against other things. It's just one perception.
Yeah.
But we know that because the doctors have actually called off the strike.
They did that.
But how has that fractured the healthcare system in Nigeria? So much so that we are beginning to see a rise in self-help, people using more over-the-counter remedies as against going to primary healthcare services, because probably some will say it's cheaper, and some will say it is closer, some will say it is more affordable, and is more accessible. And you and I know this, the risks that actually are enshrined in probably using a pharmacist who might not be licensed, and also who might not have the requisite knowledge and experience to be able to treat issues before them.
Well, the Doctors Association are going on strike is not bad in itself. I mean, industrial action is expected anyway, and they're not the one. They are not the only ones.
Frequent.
Yeah, that's the concern. Is incessant. It's been happening on and off. So I think that it is time the government gives a concrete solution to this. Whatever it is that they have negotiated should be implemented, because the concern is that they're actually asking for wages that have not been paid. I mean, you're owing doctors. These are the people who, on a daily basis, lay down their lives. You have to take care of them for them to be able to take care of the citizens. In other places, they're asking for pay rise, they're asking for all sorts of things. But these, they're even asking for arrears that the government is owing them. Everywhere, yes, wages. That is always the reason for strike. But when you are owing, you haven't even paid them. They are talking about the hazard allowance. I remember those days when I was a junior doctor, and we used to work under very terrible conditions. I remember the ECOMOG days when we had to. There was no NEPA. We had to use torchlight. And after all of this, I do all of this, and you still owe me. Yes, when two elephants fight, the grass suffers. So the patients are suffering for this. It is the government that can be decisive about this and have a stipulated, something that makes sense in reality with what is happening, so that these doctors are paid. I'm not saying you should pay them more. Let me not say them, us. You don't have to pay all, because I'm part of it. You don't have to pay us what they're being, my colleagues who are outside the country are earning. Or however, pay us in accordance with the realities of the environment. So that's what they are asking. And if that can be done, I'm sure nobody is happy that they keep on going on strikes here and there. They just called off one, and it's a 2-week suspension, meaning that we are actually looking towards another strike if government does not meet their needs.
So to the second part of the question, which it has actually opened up another industry whereby self-help is being utilized right now, over-the-counter access to medications and healthcare is now on the rise.
Well, yes. I mean, if over-the-counter drugs are the ones that are not prescription drugs, there's also still nothing wrong with that. All over the world, we're talking about democratization of healthcare. I want you to have your healthcare in your pocket. I want you to be responsible for your care. That is where we're going, but we have to do it in an orderly manner. If we are going to do, during the other strike, there was a time, I think it was earlier in the year, that it was said that a House of Rep member, wanted doctors to stay and all that. You cannot forcefully enforce something that people, that people cannot do. That's not human. The issue is that the government must be able to pay doctors right. You graduate from medical school, and after all that suffering, your mates in other sectors are earning a lot more than you. Meanwhile, you're doing more work. What do you want that employee to be telling the employer? You're going to be asking for what is due to you. So, over-the-counter drugs, there's some drugs that offer the counter drug, Panadol, you can buy that, prescription drugs is what concerns us. And however, if the doctors are on strike, there's nobody anyway there to prescribe the drugs. Nobody is going to be prescribing the drugs for you. So it is the patient that bears the brunt. The hospitals that are shut down, You're going to the chemist, you're getting your drugs, but not in the right way. Not in the right way. There's a call to democratize healthcare, to empower patients, to empower people to be able to treat, to be responsible for their own health, not just to go in and out of the hospital. We want to take healthcare outside medical settings. We want to expand the reach of people. That's why you also have telehealth, virtual health, and all of that, to expand the reach and make sure that more people are covered, more people are pulled into that ecosystem, and they have the knowledge and awareness to be able to maintain their health. Because nobody can take care of yourself more than you can. Okay. You're only assisting the doctor to do it for you, but you eventually will be the one to take care of your health.
So over time, at taxpayers' expense, the political elites are known for medical tourism at the slightest instance, yet they pay lukewarm attention to what is happening back home. And sometimes when they actually go there, they find out that most of those that are actually attending to them are Nigerian doctors.
Exactly.
So when you have that kind of scenario, what message are they sending, to the populace who voted them into power in the first place? And is it a bleak, future when it comes to healthcare? Briefly, please.
Not necessarily. I mean, and when you say briefly, nothing about healthcare in this country is brief, I tell you. But what you've just mentioned is between medical tourism and between, the massive migration, of health. And unfortunately, depends on how you're looking at it, none of them is ever going to stop. And they're not bad in itself. For medical tourism, it's a good thing for people to go out and access care, right? In a way that the country does not have to pay a price for it. Okay. Now, medical tourism can be inbound or outbound. What we're suffering in Nigeria is because we don't have inbound medical tourism, all we have is outbound. Yeah. So there's capital flights, people are going out.
At our expense.
At our expense. So we're not gaining there. Now, when it comes to migration, it's going to be on the rise. There's so many things happening in the health sector that with everything that happens, every development, every new equipment and all of that, there is a need for a medical personnel. So it's going to actually increase this migration. But the concern is that for Nigerians, they go out and never come back. And they're going in droves. You have Americans who go to Cuba and the rest of them to get trained, maybe faster or whatever is their interest. So there's really nothing wrong with both of them. It is the way the Nigerian healthcare professionals are living. By the way, in 2010, there was an adoption by WHO, which is, they call it the Code of Practice for recruitment of international healthcare personnel, right? However, it's not enforceable. It's just based on moral guidelines.
All right, as we try to wrap it up quickly, COVID-19 actually exposed the flaws in the healthcare system. And they actually also highlighted it to the major stakeholders within the system and also to the authorities.
Yeah.
Do you think they've heeded and they've tried to plug those loopholes that were noticed and that were actually visible during the height of the pandemic?
Not at all, if I could say that. Okay. Because till now, the Nigerian government is still not able to meet its budget allocation on health. Since 2001, when they had the Abuja Declaration. So the healthcare industry is still suffering. And now when it has also the responsibility to establish laws, guidelines, and standards for health. Meanwhile, when we have those policies, implementation is always a problem. So I'm afraid, and I remember during the COVID, I gave some talks saying that if we don't get it now, during this COVID, we're never going to get it. So much money was spent. However, we do not see any visible change. And we shouldn't even have spent as much. We need to concentrate on Nigeria, on integrated healthcare.
Right.
I can tell you what I need as somebody in a community. Every community can tell you what their healthcare needs are. We must not be seen playing to the gallery with donor organization. And that's what's happening because so many people are bringing money, and we'll see ourselves having programs that do not concern us. So when these donor organizations leave with their programs, we're back to square one.
All right, on that note, Dr. Dorothy Jeff-Nnamani, CEO, Novo Health Africa, many thanks for your time on the show.
Thank
It's good
you.
to have you with us.
It was a pleasure.
Thank you.